Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 481,630 confirmed cases of COVID-19 in Canada and 146,535 cases in Ontario. Chatham-Kent has 562 cases and Sarnia-Lambton has reported 460 cases. Michigan now has 446,752 cases, with 23,843 cases being in Detroit. Today we are reporting 191 new cases of COVID-19 in Windsor and Essex County. 32 cases are related to outbreaks, 20 are close contacts of confirmed cases, 4 are community acquired, and 103 are still under investigation. We have had 5,012 cases since March. 4,160 cases are now resolved and 952 cases are active and being followed by our health unit. 60 confirmed cases are currently in the hospital and 12 people are in ICU. In Windsor, there are 82 suspected cases of COVID-19 currently hospitalized. We are reporting 3 additional deaths today: a man in his 70s, a woman in her 80s, and a man in his 90s, all residents of long-term care. Our community has lost 94 people to COVID. 59 deaths have occurred among residents in long-term care and retirement homes. There are currently 26 active outbreaks in Windsor and Essex County. 9 long-term care and retirement homes, actually 27 outbreaks. 9 long-term care and retirement homes, 11 workplaces, 3 community outbreaks, and 2 hospitals. A media release will go out later today regarding the second hospital outbreak. Please do your part to prevent the spread of COVID-19. Stay home if you are sick. Limit your close contacts to your household. Keep a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering indoors, outdoors if physical distancing cannot be maintained or if wearing a mask is required. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID Exposure Alert app at canada.ca. Testing for COVID is available by appointment at selected pharmacies and assessment centers. Please call in advance to book your appointment and determine your eligibility. Windsor-Essex has 3 testing and assessment centers: Windsor Regional Hospital Olette Campus, Windsor Regional Hospital Met Campus, and Erie Shores Health Care in Leamington. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wechu.org for further information and updates. Thank you.
We'll now take questions from the media. We'll do 1 question and 1 follow-up question today. Today we'll start with CBC.
Yes, good morning, Teresa. Just last night we saw some reporting from London that they're supposed to be getting the vaccine, quote, in a matter of days. That's according to a memo dated Tuesday. We also know that Windsor-Essex was marked as a high priority area to receive the vaccine, so we're just looking for a vaccine update here.
Well, I don't have an update on the vaccine, and we've been asked to refer media inquiries to the Ministry of Health regarding the vaccine. So that's all I can really share at this time.
Follow-up?
Yep, and in terms of the developing situation at the Village of St. Clair, now 2 residents have died according to the facility there. When I asked Dr. Ahmed about this, I apologize, can't remember if it was yesterday or the day before, he had mentioned, we don't want to just issue orders for the sake of issuing orders. We want to make sure that, there's proper steps being taken to ensure the safety of everybody. But now that news has come out that 2 residents have died, will the health unit look at possibly issuing some type of order?
So we've been involved with all of the long-term care homes right from the beginning, and as outbreaks occur, all of the infection and prevention measures are reviewed, and they're good measures put in place and reviewed with all of the staff, and the interventions and the assistance for the homes as they go and manage their outbreaks under the direction of public health and other supporting hospitals. They have good practices in place to help address it. So when you're asking specifically about other orders, I am not aware of any additional orders other than that what's already in place for long-term care residents. And there's a whole outbreak protocol that gets followed very specifically during outbreaks. So that is what is occurring right now.
Any questions?
Okay, thank you.
Thank you. Any questions from Blackburn?
No, I'm good, thank you.
Any questions from the Windsor Star?
Sorry to make you repeat, Teresa, but just to reiterate, how involved is the health unit with the outbreak situation at the Village of St. Clair?
So we have public health inspectors are always involved in any outbreak. So once we are aware, so as you already know, that the cases are managed by the health unit in regarding the testing. So if a testing in a case comes in, either in a staff or a resident, the health unit's already alerted about the home. And then our public health inspectors go out and they look at and review the infection prevention measures, which involves cohorting, residents and looking at all of the practices they have in place. We also work with our partners, health system partners, and identify any issues with staffing issues or PPE or anything that is under their ability to support. So all of that is ongoing. We have an outbreak team that is managed between the home, the health unit, healthcare partners, and the oversight and the constant and the attention to the outbreak continues every day. So the homes are in communication with our health unit, who helps manage the outbreak, and we involve all of the other partners to try to address everything that they're dealing with.
Follow-up?
The local NDP MPPs are calling upon the health unit to exercise its powers under Section 29 of the Health Protection Act. What more can be done?
I am not sure what further measures they would like in place, but early on there were some Section 22 orders about people not working in multiple places and some direction regarding the workers and the safety of our residents. And that was early on in the pandemic, and that our health unit did initiate some of those directions at that time. So since then, there are good practices in place. Obviously, I'm not specifically aware of what further orders, but we have, the ministry's provided good direction and have incorporated a lot of the lessons learned, or not lessons learned, but the direction from earlier outbreaks for homes and retirement homes and congregate settings. So I'm not aware. I know that that was brought to Dr. Ahmed's attention, but I don't believe he's planning on issuing any additional orders at this time.
Any questions from AIM 800?
Mike, I'm not sure if this is for you or for Teresa, but on the website, when it says date reported, for example, the Village at St. Clair, the date reported was, just looking here, sorry, December 8th. Does that mean that's the first case that was reported, or that's the date of the outbreak?
That would be the day the outbreak is declared. So it would be...
Okay, so the outbreak was declared on December 8th. on December 10th, that home posted photos on their Facebook page of a Christmas party. Santa was there, unmasked. I guess when an outbreak is called, shouldn't like visitors, like a Christmas party, like Santa Claus going in, shouldn't that come to a halt? Can you just explain what the process is when an outbreak is declared? Like, who's allowed in the building still? Are parties, I'm not calling it a party, but get-togethers still allowed? What happens when an outbreak is declared?
Well, generally in outbreaks, it does impact visitors to the area and the ceasing of activities, external activities or internal activities. So I'm not aware of the particulars of this party, but generally in an outbreak situation, it does impact visitors into the building and also the activities that are currently being held where people are, brought together. So I can't comment on that specific incident, but in an outbreak that would not be allowed.
And then, sorry, during the outbreak, and I know it's when it comes to face masks, staff obviously wear on the PPEs, but when there's an outbreak declared, does a resident have to wear one?
The residents aren't, I'd have to check on that. I don't believe the residents are wearing the mask, but the staff would be. And any essential caregivers to the home. So under the directive for long-term care, they're able to have designated caregivers, and they're to wear PPE as well, the masks. But I don't believe the residents have to wear the masks, but I'm not sure because they would be in their own room, isolating in their own room.
And
Okay, thank you.
thank you, Rob. Any questions from CTV?
Yes, good morning. Do you have more details on the 3 people who died? Were they in hospital at all, or did they pass away in the long-term care home?
I don't know where the actual death occurred, but they were all from long-term care home.
And were they all from the same home then?
Yes.
Okay, thank you.
Okay. Thank you, everyone.